Okay, so I already gathered my supplies, my trach selection. I did check the expiration date and the integrity of the packaging. Everything is good. I did grab myself a new normal saline. It has not been opened. The integrity of the packaging is good. It is not expired. So I am ready to go in with my patient because I already checked the MD's order, and before I grabbed my supplies, I already auscultated my patient to see if he was needing suction, and he was sounding pretty gunky. And while I was in there, I was also assessing his breathing pattern and O2 stats and vital signs. So I'm ready to go in and see my patient. Knock, knock, knock. Close the privacy curtain. Wash my hands. Hi, I'm Tiffany. I'm going to be your nurse today. I'm here to do your trach suctioning, and I'm going to move the bed to a working level. Wash my hands again. Can you please tell me your name and date of birth? Blah, blah, blah. Any allergies? No? Okay, good. So like I said, I'm going to be doing your trach suctioning, so I'm going to move you to a comfortable position. I move you to semi-foul. Is this okay? Yes. Okay. And so I am going to make sure that I turn on the suction over here, and it's going to be at 80 to 120 because this is an adult patient. And then I am going to want to hyperventilate your oxygen during this procedure. So I'm going to turn that up to at least 10 liters per minute. Okay, and so then I am going to take in my normal saline, open that up, making sure it doesn't flap back on me. Stepping out of the way so I don't contaminate my sterile area. Okay. Grab this. Set this aside. Right there. And I'll need to grab my suction catheter here. Wrap this up in my hand, and this hand is going to be my sterile hand. This one's going to be my clean hand during my procedure. Okay, and then I am going to contaminate my clean hand. Pour this in here. And then I need to connect my suction catheter to my suction, making sure I don't contaminate. We're pretending this is my suction. We'll put that in there. Okay, so like I said, this hand is now clean, my dirty hand. Okay. And we're all hooked up. Suction is working, and I want to make sure I lube up my catheter here. And we are doing intermittent suctioning. And this is connected to my catheter, or to my suction machine. I'm going to remove my oxygen here. I'm not going to have my thumb on it while I am inserting because we don't want the suction occurring while I'm putting the catheter in. Okay, and I'm going to keep going until my patient coughs or I feel resistance, then I'm going to pull back about 1/2 inch. Okay, maintaining sterility. We'll pretend I'm still going down some. Okay, pull back a little bit. Okay. Put my oxygen back. Noting the color, consistency, any odor of the secretions, and the amount. I'm going to rinse that off. Okay, and then I am going to do it one more time. I'm going to make sure I remove the oxygen here. And while I'm suctioning, I'm making sure to assess my patient's breathing, color, any cyanosis, making sure that I'm watching the heart rate and O2 sats. Okay, and we are going in. Finger is not on suction. Pull back. Okay. Oxygen is back. I'm going, again, noting color, consistency, looking at the characteristics of the secretions there. And I'm going to rinse that off. Okay, and it sounds like my patient is doing a lot better, except the oxygen fell off, so I'm going to just put that back on. Sounds like my patient is sounding a lot better, so I'm going to discard my supplies. Wrap this up, disconnect. Wrap this up in my gloves. Throw that away. I'm going to turn off the suction over there, and I'm going to make sure that I assess my patient, respiratory status, O2 sats, auscultate the lung sounds again, and making note of vital signs, and also noting how my patient responded to the treatment and tolerated the treatment, which it looks like it was good. So I threw all my garbage away, and the bed is in a low position, and then in a low position, and you have your call light good. And so I need to make sure that I document how the patient tolerated the procedure and the color, consistency, any odor and amount of the secretions obtained. And then I also need to write down the patient's O2 sats and their vital signs. And like I said, bed is in low position. Here is your call light. Please let me know if you need anything more, because I already did my assessments of lungs, cyanosis, and vital signs. So please let me know if you need anything. And wash my hands and leave.